Hello, in this video, I'm going to be talking about loss of libido and what to do about it. Before I go on, I want to encourage you to subscribe to this channel. We put new content out all the time. We also update previous content, and many of our ideas for our videos come from you, from the questions and comments that you put below, so keep them coming. So libido is our sexual interest, our interest in being physically intimate. But it's not just physical, it's emotional and mental, and some of it is patterned, and it's real. And a lot of times when you go to somebody in medicine and you tell them about this, they don't know the right questions to ask, and they don't know how to help. Very few physicians are trained in helping people navigate challenges in sexual health. So why might libido be decreased? Let's start with the fact that you've gone through a major life trauma. So imagine it's not even breast cancer. It's something like losing your job. And I don't want to trigger anybody, but that is traumatic, especially the way it's done sometimes. And that changes everything about how you see yourself, your identity, your role in the world. You start to have fears about how will I provide for my family? What does this mean for my future? That is going to kill your libido. But throw in all the things that happen with breast cancer, the endocrine therapy, the chemotherapy, the changes in the way your body looks, loss of hair, loss of pubic hair, loss of your eyebrows and eyelashes, loss of a breast. Perhaps you've had surgery that leads to pain. You might have pain in the breast, a reconstruction site, lumpectomy where the lymph nodes were removed. And if you had your own tissue used, you may hurt in your abdomen or in your back. Then throw in hormonal changes, throw in role changes, throw in the anxiety, depression, fear, rage that you might have. And it's really no wonder that your interest in sexual intimacy may decline. Diagnosed with breast cancer? Meet Yerbba, your guide to personalized treatment options. Each option is specifically tailored to the unique characteristics of your tumor. Sign up today at Yerbba.com to take control of your breast cancer journey. If you are a partner of somebody going through this, we see you. We understand this is hard for you. It's really important to put right out front that sex is not just about the physical aspects. Sex is a functional part of a healthy relationship. Now, what that means for different people is different. So for some people, a healthy sex life includes certain things that we do, and for some people, that's not even part of the consideration. But there's something about physical intimacy, whatever it looks like in your relationship or relationships, that matters to your level of closeness with your partner or partners. So let's just put all that out there and say this is not okay to ignore this. This is very real. It's another source of grief and stress. If your relationship was stressed in other ways and this was the one good thing in your relationship, this can actually feel like a threat, whether you're the person going through breast cancer and its treatment or a partner of somebody who is. So here are some approaches. The first is really get crystal clear on what intimacy means to you. For some people, it's being naked in bed with their partner. For other people, it's dressing up in sexy lingerie. For other people, it's touch, and it's not always the genitals that need to be touched for people to feel aroused. For some people, they might enjoy being touched at the nape of the neck or their abdomen or their back. So getting in touch with what feels good to you is one of the first things, especially if you've had a break from physical intimacy, from sexual intimacy. Getting used to figuring out what feels good to your body and talking about that with your partner. So saying, that feels really good, that doesn't feel as good. That feels great, I would like more of that. It can actually be a way that the two of you can discover new things about each other's body. The other thing I would say is do not talk about your sex life directly in bed. Don't bring it up as a problem. No matter which partner you are, in bed. This is a great conversation to have when you're driving together in the dark. You're not looking at each other, and sometimes it feels safer to have a conversation like this in a restaurant where you have a private table, or like I say, when you're driving or when you're out for a walk. The reason that is because in bed it can feel really threatening. People can feel judged about how their body looks or how they're, quote, performing in bed. And just being away from the bedroom or wherever it is that you have physical intimacy can be really helpful. It can also be really good to have the conversation when neither of you is just stressed about it. You can say, if somebody is, let's set aside time to talk about that. This is important to me. And if they agree, then you're doing it when the emotions aren't really hot, and you can be really honest with one another about all of your feelings. So how common is loss of libido? Get this, 80% of people who've gone through breast cancer treatment and other cancer treatments, though it's not been studied as much, report declines or complete loss of libido. That's out of 5 people, 4 people will have problems with libido. Yet you haven't been told about this in your doctor's office, is my guess. It's unlikely that this was brought up at the beginning of your relationship with your doctor. What that can do is give you the message that this isn't something to talk about with your physician. You know, I think we're called upon as a society to have professional conversations about physical and sexual intimacy. And a doctor I know says the very first appointment, we're going to be working together for a while. I want you to know sexual health is part of your overall health. You can talk with me about this anytime. And then often it doesn't come up until a year or 2 later. But the doctor opened the door. So what can you do as a patient if you don't have that doctor? When you first meet, say, I'd like to share a few things that are important with me. And you say, it's really important to me that I be able to work. Or it's really important to me that you put me on sick leave. It's really important I be home for my kids. And my intimate life is very important to me. I'd like to be able to talk about that with you. And if not you, who else could I talk about with this if any problems arise? You're just being brave. This is a medical issue as much as it is something that is reserved for, you know, when the lights go low and the music's on. This is caused by medical treatment and a medical condition. So I'm just giving you here carte blanche to open this door. You may find it easier to talk with a nurse or a social worker or a navigator than to your physician. It's possible. It's also important to know that your doctor, unless there's somebody who studies this, may not know a lot about it, and be prepared for them to say that, and be prepared to ask for a referral to somebody who's a specialist. It's very likely if you have a gynecologist or a primary care doctor that they do know people. You can also Google sexual health clinics in your area. You can also ask around in the community forums that you're in, the communities that you've created where you live. There are lots of great books about awakening sexuality and libido after cancer. There are many resources available to you, not just this video. Here are some things you can do when talking to your doctor. Be as specific as you can. It's really easy to say, I'm not feeling like myself, or for your partner to say, she's not quite herself. Your doctor won't know what that means. They're going to think it's fatigue, depression, nausea. They're not going to understand that you've had a loss of libido. If you have to write this down and read off a script or look down at the page while you bring it up, you can do this. This is really important, and actually your doctor does care about this. They may just not have the skills, because medical school is 4 years of really intense focusing on pathology and much less on thriving and flourishing after cancer. That is a gross overgeneralization. Many oncologists specialize in survivorship care. And just to jump to the point, in addition to getting to know your body, what feels good, what doesn't, and being patient with yourself and your partner being patient with you and you with your partner, you can try something simple as moisturizers that you use in the vaginal vault and around the vulva, even when you're not being intimate. That will help the tissue not feel so tender and feel so sore. And then during intimacy with any vulva or vaginal contact, to use moisturizers. And we're putting on the screen here some different things that you can try. I've covered a lot. I know this has probably brought up a lot of feelings. I know there are things that I don't know. Feel free to put a comment in the chat below or a question. Share what's worked for you. We don't give medical advice, as you know. We appreciate your being here and being part of this community. As always, thank you for watching, and we'll see you next time.